Hello everyone and welcome to our podcast. Today we have a very special guest who is a visionary in transforming how a business strategize with the innovation through AI. We are thrilled to host Mr. Aarsh Srivastava, CEO and co-founder of Gravitas AI, a passionate advocate for ethical AI. Aarsh has a years of experience in business strategy, user-focused product development, and mentoring future leaders. With a double MBA and global recognition as a speaker, he is shaping the future of AI and business. Today, we will be talking about 360-degree healthcare transformation with AI. So let's dive into the exciting conversation with Mr. Arsh. Hi, Arsh. Thank you very much for giving your valuable time.
Hi, Mr. Farooq. Pleased to be here and thanks for the invitation.
So, Arsh, can you help me out with what inspired you to explore the intersection of healthcare and AI?
Well, it's been a story definitely, and we were working. All co-founders were working in different areas. So as we know, we Gravitas has got four co-founders, and we got different type of expertise. So I was primarily working into healthcare sector with AI since about say 10 years. Since 10 years, so basically it's about 16, 15. I started working in this area, and I was leading like world's first healthcare chatbot back in 2016, and that delivery was really amazing. So post that, there's much more interest for me to explore more into healthcare because I was working in some other segments as well for artificial intelligence. But with that kind of interest, I started focusing a bit more on healthcare, and the other co-founders who got like years of experience in the healthcare, such as Mr. Mukesh. He's got about 3 decades of experience in healthcare. So we started joining forces, and then we have a technology visionary in Ankita, who's experienced with global MNCs and like has been global technical architect and compliance and compliance specialist Sumit. So we all come together as like a complete package in terms of business strategy, healthcare expertise domain, and then the technology and the compliance aspects, which are very important for healthcare. So that's how like we started thinking that that is the first sector we want to like get into, because one, it was based on what we have as an expert, like as a group, combined expertise, but also at the same time the need, because healthcare typically has been a bit unorganized, and there's a need to like do a lot of automation with there to solve the problems, solve the challenges which patients are facing, solve the challenges which hospitals are facing, and also derive insights and try to inform them about like what kind of possibilities are there with technology. So that was the motivation behind we getting back to healthcare.
Amazing, amazing. It's good to know like the like-minded people are coming into the one platform and to try to solve the real problem in the healthcare segment. Okay. So moving on, like how do you envision a 360-degree transformation in the healthcare driven by AI? So since you're talking about the AI in the healthcare segment, so how do you envision? What's your motive?
Well, a 360-degree ecosystem is the need of the hour. We have got multiple technologies in picture, and which can provide a lot of like ease to the different stakeholders. And when you're talking 360 degree, it can come from different angles. One from a user perspective, second can be from technology perspective, third from is from more from a like strategy perspective. So we need to consider all these things together and blend it together to have like a complete ecosystem which has actually got the potential to transform, and not only transform but also like transform, reform, and at the same time like create sustainable ecosystems in healthcare. If you see like there's at one angle, patients are there who are like not having the right kind of information, support, assistance, because the healthcare systems are overstressed. There's a lot of like flow inflow for doctors, and they are facing issues with that. And then because of the unstructured nature of the sector, there's a lot of information which is there. It's a gold mine to like be worked through, but we are not able to like get it because we don't have the structures in place in terms of technology. So a very well thought through system is very much needed in this hour, where we can have a complete ecosystem connecting the three key stakeholders, which is the patients, the hospitals, and the vendors supplying to the hospitals. And that is why I envision the 360 ecosystem. Having said that, there are multiple subversions of that, wherein we can have a 360-degree AI communication system, so that patients can interact, because patients interact through different mediums. Sometimes they're just coming walking into the hospital, They're trying to get some Google reviews. They're trying to interact with them on Google websites, web forms, trying to interact with different platforms which are available. So how do we make those platforms connected? So there's a seamless, consistent, accurate 24/7 response system available for the patients, but at the same time, it's not like confusing them and not providing them with the misinformation, which is very much there. If you Google about anything, you get like 50% of the Google searches come as cancer. Okay,
Yes,
so if you put something in and you get like this might be something of that sort, so that actually creates a lot of panic. So we need to be very careful about that. So having a 360 ecosystem where like a web, WhatsApp, Google Chats, messengers, Instagrams, emails, etc., all are powered through AI, and like they have the seamless consistent information, but not only that but also the accurate information which is being fueled by the healthcare professionals themselves. So how we are taking this forward is that we're working with SMEs, doctors, and healthcare specialists in a particular specialty and subspecialty. For example, if I'm working in healthcare in a particular domain, I'll go further down with the specialists and try to understand from them what actually they need to provide, and can get them on board as SMEs, and we're working with them on the content, so the content is robust, accurate, and seamless, and at the same time is the right kind of content which is provided. Then comes the second ecosystem, which is the internal ecosystem. There also a lot of automation is required. There's like departments which are there which are not talking to each other. There's a lot of data which is sitting in different departments under the walls, so those walls need to be connected. How we connect that is dependent on how we strategize. So we have to like get back to the drawing board, draw down the picture, complete picture, try to identify what are the 6, 7, 10, 15 user points, and then start dissecting that to identify where we can infuse technology, because it's not just about AI technology. We have to see where we have to do automation, where we have to put in AI, where we have to get conversational AI, where we have to get generative AI, and similarly where we have to get insights out of it. So that is how we can connect it together and definitely produce a very good synergy. So a user has to be in the center of everything which we want to develop.
correct, correct, understood. So I just want to let's get into the practical. How much affordable is using the AI in a rural segment, like in urban cities and all? They might afford all this AI technology integration. But when we talk about the vast majority, which is the city outside the cities and all, so how much affordability they can afford on the and what are the segment, what are the steps are that companies are taking into those areas?
Yeah, so there are two sides of the coin. Definitely, one, how the businesses, how the healthcare ecosystem will react to it. So we have to look at something which is sustainable. And when I'm talking sustainable, it has to come from all angles. So whether we are talking financially, whether we're talking like operationally, whether we're talking strategically. So it typically in rural setups, and today WhatsApp is a boon, and how WhatsApp is like transforming these kind of like situations in terms of like utilization of technology is really phenomenal, because we have got the reach, and with the digital financial revolution in India, like technology has reached every mile. So now people are aware, people are doing Paytms, the people are doing like online money transactions everywhere. So they are using the QR code. So they're pretty used to the mobile phones. So that is how we can get to the masses, because through WhatsApp AI automation, we can do a lot of assistance for patients to get the right kind of information, right kind of assistance, right kind of appointment bookings, right kind of platform to give and provide solutions, right kind of platform to connect virtually, right kind of platform to also not only get the pre-consultation and the appointments booked, but also post-consultation, daily care, support systems, all of that. And that is possible through a lot of messaging which can be pushed through WhatsApps after getting consent. So all we need to do is like to think about, see, when we are developing technology, it has to be like user centric, as I've told before as well. We have to think about how the end user will get benefited and how, in which way we can get to them. That is very important. So I think WhatsApp has got a great potential in getting to that. But at the same time, if you look at sustainability and like ROI centric perspective for the healthcare organizations, it's also like not very expensive these days, because like if you talk 10 years back, we used to do £1 million projects in AI for simple systems, but now things have evolved a lot, and there's a lot of scaled operations which can be done at a lesser cost. There are now data centers available in India. You can be utilized. There are like a lot of technologies which have become very cheap in terms of users, because the model has changed. It's coming as SaaS now. So SaaS models are much more useful in those areas.
Yes, sir. So very interestingly, you touch a point like the cost effective and the sustainability point of view. Now, I just want to know, we will talk about the sustainability and all those things. One thing is from like the data privacy and all. So everybody, I talk to everyone like how the data privacy and all this, how to ensure all those things. So
Hmm.
how do you work and how do you see like as compared to, for example, I just want to get in touch or want to touch like the Indian perspective and the outside India, the international one. So do we have some kind of data privacy security things like
Definitely, and that is very important because see, in healthcare especially, we are dealing with very sensitive data. It's not only personally identifiable information; it's a lot of personal information, and invasion of that is not really good. So we have to be very careful about how we are using technology to implement about the larger good, but at the same time, how responsible we are in terms of like preventing the data from getting leaked out or like managing the data in a way that is convenient and at the same time acceptable by people. So we have to consider that. There are multiple regulations. For example, in EU, we have got a GDPR, General Data Protection Regulation. Now, India, we've got a DPDP. There's a recent kind of like not law actually, but AI. Since for AI, things have been like some regulations have been passed in the EU as well, and I was reading about it. And similarly in India, there's a framework which is being developed. I'm aware about that. There's something which is going to come pretty soon, like in some few months' time, about how to use AI in a way that it's like not only useful but at the same time be protected. So so governments have to do their bit. The regulatory agencies have to do their bit to provide the right kind of frameworks within which the companies and the organizations and the solution providers plus the businesses should operate. At the same time, it's very much a responsibility of the organizations, the suppliers, and the people who are purchasing these solutions as well to think and think through that how responsible we should be in terms of handling data. We need to ensure that each and every organization has its own data privacy policies, which is in line with the government policies. But again, the things differ from different organizations. They store different for different purposes. So based on that, they should have it clarified. The end user is aware about the users of data, and we are taking consent. So consent management is very much important, and how we store that consent, how long we store the data. Can we store only the data which is for the purpose? If there's no purpose, should we delete the data? So these are questions need to be asked while doing a project, and specific with AI, because this has got a power to not only transform the data but also predict a lot. So we have to be very careful, and I think the security is good. We need to apply it, but we have to be more ethically responsible towards security.
got it? Now moving on, can you share your personal experience like which upcoming AI advancement in healthcare excites you the most? Like from your personal perspective, because since you are into the industry and also into working from UK, so you know better the international technologies also and what are some what are working in the India. So what excites you the most?
I think from technology perspective, like conversations excite me most, like, and that is why we are working into that area as well. As a founder and CEO, like we have taken that to try to work everything through conversations, because ultimately, if you see, like, uh, communication is a signal line which connects everything, whether it's business, whether it's personal relationships, whether it's like communications with like doctor, or if you're doing something else. So if the communications are driven in the right kind of way, then there's every possibility that the results will be optimized, operationally efficient, going in the right direction. And also if it's all taken very like carefully, then obviously like people also feel very, very good about it. So there's a like a happiness quotient also associated with it. So there are multiple technologies we are doing, like the technologies to do clinical research, predictive analytics, like you can do a lot of diagnosis. Robotic automations are coming in terms of surgery, very exciting, definitely. But ultimately, if you see the like pulse of humans, we are driven by conversations. So that is where I see like I get most excited about how to manage things through artificial intelligence with conversational capability driven through the ecosystem at different user touch points. So it's not only about providing a chatbot to a patient, but how do we think that okay, that end user is getting benefited, whether it's a patient, nurse, a hospital staff, a doctor, or or maybe like the operational guys who are sitting in the hospital, or maybe the suppliers who are supporting them, or maybe the ambulance guy. Okay, so how we connect all those that ecosystem through conversational systems so that they can just converse. They just need to express, and we connect it through the technology so that the technology is doing their bits.
Wow. It's very exciting. The things are happening so rapidly in the healthcare segment. In these couple of these years, we have seen a drastic change and drastic, completely through new innovations are taking place uh, in terms of securing the pay, giving the patient experience and new kind of experience. So moving on, like how can a healthcare institute prepare themselves from an AI-driven future?
Hmm. That's a very interesting question. So first thing first is to like, my advice is to like look inside, try to understand where you are. So I think probably like getting a strategist or like not a technology, a product strategist, something of that sort, will definitely help, or a business strategist who can look into actually the different silos of the healthcare ecosystem and try to identify. So first thing first, if we're doing anything, we have to identify the current state. Different organizations will be in different states, so we have to understand where they are, where their feet are actually at the point of time, and then we start to think, okay, these are the areas where they are doing good, areas we're doing not so good, some areas were actually worse. So how do we improve the experience? And on the basis of that, we start thinking about, okay, whether this particular area needs technology intervention or something which is more manual, which is required. So it's not only about say technology every time, because sometimes if our patients need care, they need human support as well. So things which we have to think about, like things which needs to be touched and things which don't need to be touched or need to be supported in such a way that is optimized, the operations are optimized, but still the human touch is there. So based on that, then we have to devise a strategy for different departments, join it together. And that is how I see like AI implementations and process automation implementation come into the picture in the right way for the organizations, because then they are knowing the where they are, what they need, and their aspired state which they want to be, and then how to bridge that gap through different technology interventions or like other type of solutions which are required. That is the way to move forward. Then they'll have a complete picture of the current state, to be state, and how we can proceed. And also, it's not advisable to implement technology in one go for everything. A milestone based approach is always better. We have to carefully understand which are the low hanging fruits and first work towards that, and then start moving sustainably and like seamlessly towards the future so that we can get to the right point at the right point of time.
Okay. Yes. Can you help me out with your personal experience? Which are the technology which you
Hmm.
feel like it's really fascinating, like in the recent past? How can you help me out with that, please? Can you tell us frankly?
Yeah. So generative AI has got a lot of potential in the area which we are operating. Then there will be a lot will be heard about the robots who will be doing a lot of assistance to the doctors. There already like surgeries be happening to that, and I see that coming up as a that area coming up or evolving a lot, so that doctors can have the right kind of assistance. So doctors will be doctors. It's not that doctors will get replaced, but the right kind of assistance so that their stress levels can get down. They are like busy people, they like get lots of like people coming to them, so like they need to be de-stressed, and that is how AI can come into picture and support them. So one, robots coming to the picture and trying to do the BAU tasks, that is one thing. And apart from that, generative AI, through generative AI we can do a lot of stuff. Already a lot of effort has been cut and is being cut through that. So I think that other is another technology which will actually lead the way. Apart from that, like at different points, process automation, that is has to be there anyways. So it is like a BAU, unless until you automate, you don't know where you implement different kind of technologies. So I think in my understanding and opinion, like these two areas are to look around.
Oh, thank you very much, Arsh. So it's been it's a quite interesting insights you shared with us. Thank you very much for sharing your time. And so with this, like we have come to an end because I don't think so. You already touched the sustainability, eco-friendly, and the AI, which other technologies are coming, the patient-centric security data and everything. So thank you
Mhm.
very much for your time. And thank you very much for joining us today for this insightful conversation. And for the audience, we hope you found it as inspiring and thought-provoking as we did. If you really enjoyed our discussion and want to see such more engaging content, please don't forget to like, subscribe, and share our channel. Thank you very much for your valuable support. Thank you very much, Ash. Thank you.
Thank you, Mr. Farooq, for hosting me. Have a great day.